So, in today's class, we are going to talk about GI radiology. GI radiology. GI means gastrointestinal radiology. Gastrointestinal radiology. Okay. So, we'll talk about GI radiology. So, what are the topics we will cover? GI radiology. First is different types of imaging. Okay, different types of imaging. We will call imaging modality. Okay, we- imaging modality, different types. Okay, and anatomy of organs, study in X-ray, CT, MRI, and other scans. Okay, so these two things we will cover. The first is imaging types or modes or types. We have number one, we have X-ray. Second is barium X-ray. Okay, and the third one is we have CT abdomen, CT abdomen. Fourth one is we have MRI abdomen. Okay, and last one is we have fifth one is USG, and other sixth one is EUS. We'll discuss. Seventh one is colonoscopy. Okay, so these are the seven types of modes or imaging are present for GIT. So what are the organs are present in GIT? It starts with mouth, okay, and we have esophagus, okay, you have stomach, okay, and we have then afterwards small intestine, large intestine. So they are the pipes, okay. Names are changed according to that area and function. Mouth, starting from mouth, esophagus, stomach, small intestine, and large intestine. In between, we have liver and gallbladder. Right side, left side, we have at stomach level, spleen, and pancreas. So these are the important organs are present in the gastrointestinal tract. So if you want to study about all these organs, so we need any pathological findings, structural findings. If we want to need, we need to do all these types of according to the need of the patient, condition, disease. We will advise the radiology image to the patient. Okay. So in that we have X-ray, barium X-ray, CT abdomen, MRI abdomen, USG abdomen. This is endoscopy of upper abdomen, lower abdomen, colonoscopy. All these are for to study the detailing of the structures of digestive system. So these are the important organs we have to know about that. Okay. So basically, first we have X-ray. In the X-ray, we have one type of X-ray that is called X-ray erect abdomen. Erect abdomen. I will show you the image of the erect abdomen. Okay, you can see that this is the abdominal X-ray, or else you can call abdominal X-ray directly. So you can see this is the image. You can see abdomen. It is start from diaphragm. Okay, it is starting from diaphragm. You can see this is the spleen, splenic flexure. This is the descending colon. Okay, this is the navel piercing. This is a pelvic bone, femur bone, right, left femur, right femur. Okay, right femur and left femur. Here, this is the pelvic bone, sacrum iliac, between iliac sacrojoint. These are the feces, ascending colon, ascending colon. This is our lumbar region. This is can transfer colon, liver. So everything we are able to see in this normal X-ray. Okay, this is we call erect abdominal X-ray. Okay, to see the internal structure of the uh, GIT. Next is we have barium X-ray. Barium is a liquid. Okay, barium is a type of chemical which is used to see the internal images with the help of that. Okay, it is a okay, it is a metallic substance. Okay, chemical element. Okay, with the help of that, it will enter into the body, and what happened that area will see in the image exactly how you want to see. Okay, means much more than X-ray, much more than X-ray. We will give more information than X-ray. So let's see the image of barium swallow. Okay, you can see. Okay, so we have different types of barium. So you know that we have organs. Depending upon the organs, we will select the scans like esophagus. Okay, for esophagus, we will do barium swallow X-ray to see the image of uh, image of the esophagus. You can see that this is the esophagus. So it is a tumor. So when you are inserting the barium, you are taking the picture of that area very clearly. Here you can see cancer cell, esophagus. Okay, barium sulfate is advised him to swallow. Okay, while swallowing, the technician will take an X-ray of your esophagus or upper GI. Next type of X-ray you have that barium meal. Barium meal is advised to see the internal structure of mostly stomach. Okay, mostly stomach and duodenum. Stomach and duodenum. Stomach and duodenum. Stomach and duodenum. You can see that this image. This is the stomach. This is the stomach part. This is the small intestine, large intestine. But when you are taking the barium meal, here the stomach is able to see very detailed. Next we have barium follow through, barium meal follow through, barium meal follow through means it is continuation. It's not only stomach, all the internal organs after the intestine. You can say this is the uh, duodenum. Okay, stomach of the duodenum, duodenum, ileum. Okay, so right side you will get duodenum. Okay, and left side you will get sorry, right side you will get ileum. Right side, left side you will get duodenum. How can you identify that this is feather-like substances? Feather-like, wing-like substances are mostly duodenum. This is ileum. So right side ileum, left side duodenum. Duodenum, duodenum, ileum. Ileum. So this is the third type of X-ray. Fourth is barium enema. To see the large intestine, barium enema is given, and large intestine scan to be done. Okay. So this is X-ray for different organs of our body. Next is important thing is that is X-ray after you will have CT abdomen. CT abdomen, we have three types of CT abdomen. One is NCCT, second is CECT, third one is CT enterography. Enterography. So where to use? Okay, it is very important. In which pathology we have to use this? If you want to see pneumoperitoneum, any type of infection, okay, or any type of cyst, you have to go with the NCCT, non-contrast computed tomography. Okay, without contrast. If you want to see the inflammation, infection, tumor, cyst, all like in the pelvic region, tumor, fibroid, everything you can see in the help of CECT with the help of contrast. With the help of contrast, you have to select CECT. Okay, CECT is the best for all types of tumor, inflammation, bowel inflammation, small intestine, large intestine, etc. If you want to more focus on mucosal thickening, okay, mucosal thickening or mucosal condition, okay, you have to go with CT enterography. CT enterography. CT enterography. CT enterography, mostly it is used in ulcer type of diseases like TB, okay, Crohn's disease. In all this, we have to go through CT enterography. Okay, so this is how where we would use CT abdomen. Now come to the part of MRI. MRI abdomen to use if you want to see soft tissues in detail. Okay, all types of pathology can be help here for MRI abdomen, and mostly like ovarian mucosa, okay, rectum cancer, okay, uterine pathologies, uterine cancer, okay, more detailed study of mucosa, cell or tissue, you have to go with MRI abdomen. And one thing is helpful for this is you can take for low risk of radiations for MRI. Low risk of radiations, pregnant ladies can be done easily, children's can be done easily, MRI. Okay. And one is that you have like CT enterography, we have MRI enterography. MRI enterography. MRI enterography is much more than CT angiography. Like we have TB, inflammation, any type of cancer, any type of ulcer type diseases, we have to go through MRI enterography, TB and Crohn's disease. In that, what will happen? Two types of fluid can be advisable. That is, one is mannitol, which absorb the water. Osmotic diuretic is. Next is peg-leg. There is also a absorb water. So after absorbing water, you can see the walls of intestinal easily. Okay. So TB, Crohn's disease, all etc. type of diseases can be uh, had- can be identified with the help of MRI enterography. Next, we have USG abdomen. USG abdomen is the first investigation of choice for all types of abdominal diseases. First, like acute, mostly acute abdominal diseases. Okay, so this is the most first line of investigation choice. After that, you can advise the patient need MRI, CT, X-ray, anything. Okay, so this is the important thing related USG abdomen. Next, we have EUS, that is endoscopic ultrasound. Endoscopic ultrasound. Endoscopic is ultrasound to see the mostly the esophagus, stomach, ulcer, okay, pathologies, layeric pathologies. So if a person having any ulcer, you have more than easy than CT. CT, then you have to do endoscopy. Endoscopy will give the upper how much it entered into the upper layer of the stomach or esophagus or duodenum. But CT will give the depth, width, everything, length, the breadth, the width, everything you will get from the CT or MRI. Okay, so endoscopy and ultrasonography is the also done for tumors, ulcers or mucosal thickening, etc. Next, you have colonoscopy. Colonoscopy for doing to see the internal problems of colon, mostly for with the help of endoscopy. You cannot go with to the large intestine or small intestine. It will take time, okay, and it will hurt the patient. Very, very long distance to be traveled. So that's the reason we go through the rectum, anorectal space. Okay, anorectal space. Okay, so like any type of colonic stricture. Okay, like that. Okay, so you have to see the colonic problems. You have to go through with colonoscopy. For esophagus, stomach, and pancreatic head tumors, you have to go through with endoscopic ultrasonography. Ultrasonography, you can do the biopsy also sometimes because we cannot uh, uh, we have, go to the stomach and directly you have to cut all the parts of external parts, skin and layers of the stomach, peritoneum, everything. So not damaging to the patient's organs or body. You can directly enter into the pancreas with the help of endoscopic ultrasonography. So these are the different types of scans are available for different types of pathologies. Okay, so we have to understand that. So according to the condition of the patient, we have to advise the patient. So if a patient come to your clinic with the help of severe abdominal pain, so what is the best scan for investigation of choice? Answer, please.